Hello everyone, welcome to my channel A to Z Nursing Notes. My name is Rupinder and I'm back with another video, options for the IENs before getting the registration license. So as you all know that I have been posting videos regarding the NNS process, how to apply for the NNS application and how to go through how to meet the various NNS requirements and guiding you through the CNO registration process as well as getting your license transferred from the NYSED. Um, this throughout this whole process of getting the nursing license is usually very time consuming. And of course, when you have immigrated to Canada, you'd have to work in order to get those the expenses for this and these application processes as well as for your survival. So you have to work somewhere to like for your living. So today's video, I will be discussing about the various options which are available, especially in the healthcare sector instead of working anywhere else or going for the labor or warehouses jobs. So let's discuss the options that are available to you guys, even if you don't have any license. So you can work as a PSW, as a clinical extern, as under the SPEP program, work as a temporary nurse or as an NGG in under the NGG program. So the first and the foremost option is working as a PSW. As PSW, you help the patients in their activities of daily living, providing them with their routine care, support, and assistance, especially either in their residence or sometimes at the hospital or at the long-term care. So the basic job involves like helping the patients with their eating, the feeding regimen, the basic um, care, the dressing, the bathing, and assistance in all those things, and also in position changing, helping the patient to get up, and in the mobility depending upon the client's mobility level. The pay rate for this group is usually $20 to $25. Next option is working as a clinical extern. When you work as a clinical extern, you help the patients with their activities of daily living. Depending upon the organization where you're working, they may allow you to take the vital signs of the patients. You have to attend the call bells. You have to act as a sitter for some of the patients, and the pay rate is usually $20 to $25. The work of PSW or clinical extern is almost the same. Another option is to work under the SPEP program, that is the Supervised Practice Experience Partnership Program. I've talked about this in detail in my previous video, that is meeting the evidence of practice requirement of NNS. I will post the link of this video in the description box. So in this you have, if like you are eligible to work in the healthcare sector if you have met all the other requirements of the NNS process except for your language and the evidence of practice requirement. That means either if you are just left with your language requirement or you are left with just your evidence of practice requirement, or if you're left with both of them, you are eligible for the SPEP program. So in this case, you have to submit the SPEP intake form and get an employer, and you have to start working in the category for minimum of 140 hours. Now it depends upon the employer whether they want you to work for 140 hours, which is the minimum, or they will make you work for the 450 hours, which is the maximum. And also it is again at the employer's discretion whether they want to pay you for the SPEP program. Some of the employers they pay, some of the employers they don't pay. So it is all it is all the employer's decision. And if you have not worked for more than 5 years, you are not eligible for the SPEP program. So the next option is working under the temporary class nurse. This is another option if you have met all the requirements of the NNAS process, but you have not given your NCLEX exam. So you can work as a temporary class nurse. I have discussed about this in detail in Wanna Work as RN or RPN without registration exam in my previous video. I will post the link of this video in the description box as well. So you can either work as an RPN or an RN in the under the temporary class. This membership is usually valid for 6 months, and if you fail the registration exam or if you fail to register under the general class within the 6 months of the membership, your license of temporary class expires. You can work while you are waiting for your exam result and then join under the general class category. The last option is to work under the NGG program. The NGG program is actually like a program to support the new graduates who do not have any experience, work experience, so that they gain the nursing skills while they work and learn under the experienced nurse preceptor. So usually it is for the nurses who have completed the nursing, who have graduated from the nursing program. So the hospitals do hire nursing students who are yet to give the NCLEX exam. So you can work under a nurse preceptor who guides you through the hospital routines, policies, procedures, and you work under her and learn and gain the nursing skills. The pay rate is usually the base rate of $39. The term is usually 3 months. The hospital has to give you the full-time positions if you are their NGT program. You have started as NGT under them within the 1 year process. And but it is not like they are not obligated to give you a full-time position, but yes, they try to give you a full-time position within the 1 year period. Normally, even if you have not graduated from or you are about to graduate, you can still apply for the NGG program to any hospital. Some of the hospitals do provide the opportunity to the candidates who are about to finish their program or graduate from the nursing school. That means that you can, even if you're suppose you are about to graduate in September, you can still apply for the April intake of the NGT. It all depends upon the hospital if they usually hire. Some of them usually hire. So it is another good opportunity for the IENs as well as the new graduate nurses. So thank you all for watching my video, and I will be back again with my new video discussing in detail the NGG program. Thank you for watching and all your love and support. Bye bye.